welcome back to my YouTube channel. Well, it's been a minute, like I've not posted a video in a while. I don't know, in like 2 weeks or a week, I don't know, but I have been going through it. Like, I have been stressed, I don't know, I lost hope in myself. I'm tired. I cannot even begin to explain all the things I went through because people will pity for me. But I'm glad I can film again. I'm glad I'm ready to start filming again. It's been really stressful. I actually did film a video, but I don't know why I'm having this imposter syndrome, whatever they call it. I'm having imposter syndrome, so it's like a lot to handle for me. I don't know, but it has just been a lot for me to handle, like work and everything. Super stressful. I'm not even going to lie. Everything has been super stressful for me, and I've not been myself basically. But I'm glad I'm back to filming now, and ignore my long introduction. So today I'll be delving into a very crucial topic. I even prepared notes because I don't want, like, it's crucial, it's important. I don't want to take it for granted at all, because no matter how much people talk about it, it's still not enough, because a lot of people are going through it like on a daily basis and they are not even aware, or people around them are not aware, and they think that, oh, they're just misbehaving or they have a spiritual problem, when it's something like that can be medically treated or like controlled basically. So today's topic is depression. Like I said, I prepared notes, so I'll be looking at my notes. In case you see me looking down, I'm looking at my notes, and like I said, I've been going through it. Like, I'm not saying depression, but then I've been going through a lot, so my brain is everywhere. I cannot really talk from my head or something, so bear with me. So what is depression, you may ask? Depression is a mental health condition that affects millions of people worldwide. Yes, it actually affects millions of people worldwide. Today I'll be discussing its types, signs, and symptoms, how you can know if somebody around you has depression basically, and how to like help yourself, and also, and I also advise you basically. Before I start, let me say it. If you know somebody around you that is going through depression, I'm not saying it's being sad alone, because some people mistake sadness for depression, but if you know somebody that has some of the symptoms I'm going to list, I would advise that you take the person to the hospital. I think there are a lot of hospitals around that help with mental health conditions. It is not a crime to be depressed. There is absolutely nothing wrong in being depressed or going through a lot basically. So you should help yourself before it becomes really bad, because depression can lead to a lot of things like suicidal attempts. Well, let's start the video. So there are different types of depression. We have major depressive disorder, MDD, persistent depressive disorder, seasonal affective disorder, postpartum depression, and bipolar disorder. Major depressive disorder is the one that has like loss of interest in activities that you are usually interested in. You're just going to be feeling sad. It can even cause you to even start feeling sick as a person. You might start having like body pain, joint pain, but it's actually depression. Persistent depressive disorder. This is a chronic form of depression lasting at least 2 years with milder symptoms than that of MDD. It has the same symptoms with MDD, which is major depressive disorder, but the symptoms are milder than that of MDD. Then seasonal affective disorder. It occurs during specific seasons. Like some people, they are usually sad during the winter, while some people, let's talk about Nigeria now, let's use Nigeria. Some people are sad during rainy season, some people are sad during Harmattan. They just do not know what is wrong with them, they cannot understand what is wrong with them during that time. So it's seasonal depressive disorder or seasonal affective disorder. Then we have postpartum depression. This usually occurs within the first few months after giving birth. You see women, we hear things like, oh, she just gave birth and then she started acting weird, or she doesn't want to see her child or something. It's not their fault. It's depression. Depression can happen to anybody. Like, it's not written on the forehead. You cannot see on my forehead if I'm depressed now or not. Then we also you also hear things like she doesn't want to see her child, or she doesn't want anybody around her child. She might be really, really protective of her child because of this depression of a thing. Like, it's not their fault. Or men will be like, oh, after my wife gave birth, she changed, she needs help. If you're These people keep moving things around upstairs. It's tiring, honestly, but I'm not going to be frustrated right now. So, like, yeah, that's postpartum depression. Then we also have bipolar disorder. This one is categorized, I've seen this a lot, categorized by two different episodes: manic episodes and then the depressive episodes. Okay, so the manic episodes consist of times when they are extremely active. They are how would I put this? Let me try and break it down. Like, some of them cannot stop talking, some of them cannot stop walking around. They're excited, they're moving, their body is just having like involuntary movement. While the depressive episodes, when they just keep to themselves, they are sad, they withdraw from everybody around them. Yeah. So let's talk about the signs and symptoms of depression. So we know, like, usually when we hear things like, I'm depressed because you're sad. Well, I won't say being sad is a good thing, but being sad does not equal depression always. If you know you can come out of it in less than a few days, or maybe in a few hours or in a few minutes, you are out of it, doesn't really equal depression. People that are depressed have feelings of worthlessness. They feel like they are worthless. They feel like they don't matter. Please, whatever noise you hear, just ignore for my sake. They feel like they don't matter. They feel hopeless. They feel stupid. They feel useless. People that are depressed also feel guilty, like of something that might have happened even years ago. They'll start feeling guilty about it. That, maybe I shouldn't have done this, maybe I caused this for myself. You hear people that have been raped before saying that maybe if I hadn't done this, I wouldn't have been raped. So yeah. Then we also have symptoms like excessive sleeping. You see some of them, they will be sleeping excessively, while some, they cannot sleep at all. Like, some people, you see that normally maybe they sleep 6 hours a day, now they cannot do anything. They just want to keep sleeping and sleeping and sleeping. That's a sign of depression. While some, they cannot even sleep, they'll stay up all night. That one is even more scary as far as I'm concerned, that not being able to sleep, because that one can lead to a lot of mental conditions. Then we have fatigue and lack of energy. They are tired all the time. They don't have energy. They feel like the things that normally interest them, like, you see somebody that usually loves to party, shop, go out and do all those stuff. The person is no longer interested in those things. The person is just existing. The person does not want to do anything. The person just wants to sleep, or the person just wants to lie down on their bed and just be by themselves. That's also a sign of depression. Sorry, excuse me. Then we also have persistent sadness or low mood. Maybe you have had like low mood or sad, you have been sad for like 2 weeks straight without any change in that sad mood. Like, normally when you're sad, in a couple of hours or in a couple of days, you are like back to your normal bubbly self. But in this case, in depression, for like 2 weeks straight, they might not even be normal. They will just be that. Some of them will not want to bathe, some will not want to brush their teeth. You see girls on their period not wanting to wear pad. They are not interested in anything concerning their normal activities in their life. So that's depression. Difficulty concentrating. Some have difficulty concentrating. They cannot concentrate on stuff. They are, what they call it, they cannot make decisions. Some of them even start forgetting a lot of things. They will have memory loss. Yeah, memory loss happens once in a while. Then we have emotional symptoms, behavioral symptoms, cognitive symptoms, physical symptoms. Physical symptoms include slow movements, increased vulnerability to illness, they fall sick easily, heightened sensitivity to stimuli, they will start perceiving things, or what they call it, if you touch them in a certain way, they might scream, things like that. Cognitive, excessive criticism, difficulty concentrating, persistent pessimism, foggy thinking, poor self-image. They might not like the way they look, and yeah. So emotional signs: irritability. Some of them might start getting angry unnecessarily, screaming. They're irritated with everything that you are doing around them. It's not their fault. When you see that somebody has a change in character that has lasted for a long time, and the person has depressive symptoms, you cannot blame the person. Just try and help the person. That's what I would advise. Reduce self-esteem. Someone that's normally very proud of themselves or like confident, the person is now withdrawing. The person cannot talk in public places. It's just they feel empty basically. That's what depression is. You just feel empty. Sometimes you feel worthless. These are things that we ignore in so many people, but we only see it and concentrate on it when it becomes worse, when it has passed the stage that, okay, there's no going back, or even the going back might take a long time. If we start treating depression early, these symptoms will not like become worse or like increase. We need to actually take our mental health seriously. I know in Nigeria they'll say you are misbehaving if you are saying I'm depressed, or your Nigerian parents will tell you, God forbid, you are not depressed in Jesus' name. No. If you know that this is what has happened to you, you should take it seriously. You should try and help yourself. Well, first thing you should do is seek help and treatment. Go to a hospital with licensed psychiatrist or psychologist and talk to them. Then you can also engage in activities, even though I know you are not interested in those things that you're normally interested in. Just try and push yourself. Like if you have a relative that is like that, try and push the person and be like, oh, let's go and join this, let's go and join that, let's have fun, let's go out and eat, let's go shopping, stuff like that. Maintain your healthy diet. Make sure you try and get enough sleep. I'm sure if you go to the hospital and you're not getting enough sleep, they'll prescribe drugs that will make you sleep there, and also antidepressants. Then build a support network. Yes, tell some family and friends that you know that they are going to be there for you and they're going to talk to you anytime you're having those depressive moods. Or because one thing about depression, I would say, one thing about depression is depression has its good days and it has its bad days. It's not good every day, neither is it bad every day. You might start taking your drugs, for instance, and then you see that you are getting better, and then the next thing you're saying is, oh, I feel better, I'll stop taking my drugs. No, you will relapse, and it's always worse when you relapse. Like, just try. When the good days come, embrace the good days. When the bad day comes, hold on to those good days. Try and think about those good days. Reach out to people that you can trust, that will not talk bad about you, or what they call it, make you feel stupid. Reach out to them and be like, oh, this is what I am going through. They will talk to you. Sometimes they might not even know how to make you feel better, but random conversations you're having with them make you forget what you're actually going through. Depression is a very serious mental condition that is not like really looked at a lot, especially in this part of the world, especially in this our part of Nigeria. It's not actually looked at or taken seriously by African parents and Africans as a whole. Please, another thing is people are afraid to say they are depressed because of the stigma associated with it. Don't stigmatize people that what they call it are depressed. Don't stigmatize them like people that this one is mad. No, it can happen to you. It can happen to your family members. So why would you stigmatize that person? It makes no sense, actually. Well, just try and stay connected to people that love you. Try and talk to somebody that you think will understand. Remember that depression can manifest in conclusion, remember that depression manifests in different ways with different people. I don't know if I should say some of the drugs that people with depression take. I don't think I should, because I don't want you to go and buy, because some of these drugs you can get them over the counter. I don't want some people to go and get the drugs and start taking without the proper diagnosis. So I would not mention some of these drugs, but I know like 3 or 4 drugs that actually work well for depression and get you out of those low moods. Like they will boost the serotonin in your brain, the hormone will be secreted so fast, and you'll be back to your normal self. But like just try to be fine. I know it's hard, I know it's difficult, I know people might not understand you, but just tell yourself that you can do it. Even at the worst point in your life, just tell yourself that, oh, I can do it, I am going to be all right. I don't know what is biting me. I am going to be fine. I'm going to get through it. I am strong. I am powerful. I am beautiful. I am handsome. I'm, what will I say now? There's this saying, where there's life, there is hope. I take it very seriously. Like, no matter what bad thing that happens, as far as I'm alive, something good will definitely come around. And just try your best. Fight every day. I know it's hard when you're depressed, but just try and fight. Hold on to the good times. Hold on to people in your life. I'm not saying, because another thing is, if you hold on to certain people and then they switch up on you, it might make you fall deeper into depression. So the most important person for you to hold on to when you're depressed is yourself. Know your worth. You are not worthless. Everybody has their worth in this life. Just be happy above all. Try and do those things that will make you happy and make you think less. You're going to be fine. It's just a phase. You're going to be fine. It's just a phase. Go and get treatment. Seek help. Talk to people that would understand. If you want to talk to me, I'm always available. Just text me. I don't like calls like that, but text me and I would respond immediately. Like, depression is serious, but you can actually overcome depression. There are so many people that take antidepressants that you're not aware of. They are nurses, they are doctors, pharmacists, engineers. They are antidepressants and they live their life every day. But one thing they realize, and they realize, is that there are good days and there are bad days. Every day is not going to be smooth for you. Just know that when you're depressed, not every day is going to be smooth, even when you're on drugs. But please, just like I've always said throughout this video, like, hold on to the good times, because if you don't hold on to those good times, you might just end up killing yourself. And then there are people that will miss you. No matter how bad you think you are, there are people that will miss you in this world. There are people that need you to survive. That is the truth. They say life goes on. Now who die, now lose. That's what people used to say. But it's a lie. There are some people that would never, ever get over your death. Because you are needed. You are wanted. You are an important person in their life. So, and please, let's stop stigmatizing people that are depressed. It makes no sense. I overheard somebody telling, because I work in a mental health institution, a man, one of those record staff, they were like, the girl was getting irritated, like upset. And this record staff was like, oh, now I see why you are coming to a mental health facility. Like, what kind of statement is that? Well, just know that you are needed, you are wanted, you are important, and that we love you. As much as we cannot communicate with you every time, please don't commit suicide. Don't lose hope. Don't let yourself go, because the more you let yourself go, the harder it will be for you to come back. Just hold on to the good times and you'll be fine. Please, let's not stigmatize people with depression. Let's help them. Every day will not be a good day for them, but the good days, remember it and be there for them for the other time that they are going through hell on earth. Because depression, I think the greatest part of depression, the most annoying part, is the fact that you are the one like eating yourself up. You will be having random thoughts. This person does not like me. Why does this person do this? I don't know. I feel people hate me. Like, so many weird thoughts will be coming to your head, but push those negative thoughts behind. Sometimes you start hearing voices that will be telling you, jump, there's no point. No, don't jump. Talk to somebody that is ready to, like, embrace you at that point. Just hold on for a few hours or a few minutes, and that person will come, even if the person is not available. Please. Well, that's all I have to say today. I know that I cannot cover every aspect of depression, and in fact, depression is a very wide topic. I cannot cover every aspect. I cannot say the drugs that people take and then they get better, because there are different drugs for different people. But One thing I can say is that we are here for you if you want to talk. There are people that are here for you. Well, that is the end of my YouTube video today. Please remember to share, like, and subscribe. Please share this video because you don't know who might need it, because a lot of people are going through depression but they cannot show it. So yeah, bye.